Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here, right now, 866-870-5752. Right here in the studio, you can speak directly with Dr. Darrow about your orthopedic issues. And when you call in today, you get the free book, Dr. Darrow's latest, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And it actually has 264 scientific studies.
So excellent. Joe, Dr. Marc Darrow here, and I'm going to give out the phone number to get some callers, 866-870-5752. That's 866-870-5752. If we missed something on the show today and you would like to call the office and get a free consult with my staff, that's not me or Dr. Grove, that's with my staff, that's 800-300-9300. They know tons of information about this. We do this all day long. Again, number of the office is 800-300-9300. And my website has tons and tons of videos of us discussing, me and Dr. Grove discussing regenerative medicine, and videos of the injections so you can see if it's something you'd like to do. And Joe, I appreciate all the information you've given us about your rotator cuff tears. I'd love to get you in the office and touch the area to show you that the pathology you have is probably not the reality of what's going on. Because when we touch the body, we find out where is the problem. And a lot of times, the pathology is so far off. Dr. Grove and I just had a patient come in a couple of days ago who came in saying that she had hip problems and hip arthritis. And we moved her around, looked with the ultrasound. There was a little arthritis, but she had good range of motion. It wasn't even the issue. It wasn't even in the same universe. It was the gluteus medius muscle on the back of her pelvis. Okay? So here's someone that could have gone down the rosy trail to a hip replacement, all right, when it wasn't even the area. And it gets very complex in the hip area because there's so many connections there. There's 14 muscle attachments to the greater trochanter, which is on the side of the what we call the proximal femur, the upper portion. And we just have to be very careful. Dr. Grove and I do not treat based on the pathology that we're told, which is the diagnosis by other doctors, which is often wrong, usually is wrong, and by images. We like to hear all the information from other doctors because they could be right and they could key us off to something very important. And like I said, I always get images because I have found some terrible pathology like cancers that were unrelated to the musculoskeletal problem and have been able to save a few lives like that. So I do like the images, but it's not that I rely on them to treat. So guess what? We have Dr. Thomas Grove on the line. And can you hear us, Dr. Grove?
I can hear you loud and clear. Good morning.
All right. God bless you, man. You're the greatest guy on the planet as far as I'm concerned, and I love you very much. And, I've been watching you the last few months doing the injections with me, and I don't think there is a finer doctor on the planet, and I mean that from the bottom of my heart. And I know your patients love you, and we're just so excited to have you on staff. And this is the first time you've been on the radio show, so I hope you don't get nervous from it.
Not at all. I appreciate your words, Doc. Hey, as always, I stand on the shoulders of giants. So I appreciate all the groundwork that you laid. And, again, it's a really easy situation. People are in pain, and they want to heal, and we can provide some solutions for people.
Tell everybody listening who you are and what your training has been so they get to know you. So when they come in, they're not like, I only want to see Dr. Darrow, which is so silly. because I really
Sure.
think you're better trained than I am. I learned on my own by experimenting mostly on my own body, and then with patients back in the early days. And you've actually had specific training in regenerative medicine that wasn't out there when I was learning. And I've watched you, for months, and am very excited about the work you do and the success rates you get. So tell people who you are. What was your training in medicine? What did you do before? I know I just texted you a couple of minutes ago. You said you were just finishing up at the gym. How much time do you spend at the gym? How much time do you spend at the gym every day?
Oh, not that much, maybe 30 minutes or so, but just something to keep myself active. But yeah, no, you have a really good point. Is I have the benefit of, ultrasound has, been around not a whole lot of time. And so I get the benefit of being a little bit younger and having the opportunity to train under some amazing physicians. So I grew up in Nebraska, ended up going to college, playing football at the University of Nebraska, ended up making captain as a linebacker there. Had a lot of fun there. And that's really how I started to learn about, the high-end sports world and what's available to the top athletes. That's when I really got involved with regenerative medicine. From there, I ended up getting really fun jobs as a strength conditioning coach, nutritional specialist, living with pro athletes, doing all their training, all their cooking, see what those guys were using, to stay on the field, stay on the ice, stay on the track, stay in the gym. I ended up going to medical school in Pennsylvania. From there, took me to Dallas, Texas, and then did my fellowship in sports medicine with a lot of musculoskeletal ultrasound training at Virginia Tech. So got to travel a bunch, been around the world a couple times working with athletes at the highest level, and have convinced myself this is the best stuff on the planet to heal musculoskeletal injuries.
Yeah, I mean, the other thing that we talk about, we actually laugh. We get together in and out between patients. At the end of the day, we laugh about how great this work is and why all doctors aren't doing it. Why are they going to invasive things when they can do conservative things that don't hurt people, and how people get better so fast with what we're doing? It's really kind of a silly, sad joke when you think about it, because
it is.
What I find, and I have tons of friends, really great friends who are doctors, and I don't like to say anything negative about anybody, but I call them dinosaurs, and we fight with each other. The dinosaurs, they're raised a certain way, and it's old school, and they're just not going to change. And they're very stiff about it, and they're not open to new things. And listen, everybody wants to be healthy. Everybody wants to be, who isn't healthy or has pain, wants to heal without surgery. So why are all these surgeries happening? I don't get it.
Yeah, it's a really unfortunate reality that, I think a lot of physicians just don't have either the exposure to it or the training in it. I mean, I didn't learn about this until I actually saw, athletes being injured and having injection instead of surgery and getting back to the field.
Yeah, well, that's kind of how it happened with me. Wow, Thomas, I hope it's not the police coming after you there.
We'll bail you out, Thomas. Don't worry.
Yeah. Come save me, guys.
Anyway, I'm glad you joined us on the radio here. If you have some more time, I'd love to just ask you a few questions.
Me too.
So you can help educate people about what this work is. Actually,
absolutely.
People, we just had Joe on the phone. He said, how many treatments? And in your experience, how many treatments is it with platelets or stem cells to have people heal? And do stem cells work better than platelets?
Yeah, it's a really common question that we get. Unfortunately, I wish I had magic vision and I could look at a patient and look at imaging and say, hey, you're a 1 injection patient, you're a 2 injection patient. My answer to patients is, it's one at a time. I don't want to guarantee that you're going to need multiple injections, because if you heal after one and you're back to your functionality level that you're happy with, your pain is controlled, no need to continue to do treatment on you. So I try to use the smallest tool to fix somebody's problem. In general, though, so let's talk platelets versus the stem cell world. Platelets in general, you're going to typically need more treatments over a longer period of time compared to stem cell treatment. Downside is stem cell treatment is more of an investment on the front end, but you heal much faster. But both are really good options for healing musculoskeletal injuries.
What do you think about what patients tell you when they come in about what their injuries are or what's bothering them?
Yeah, so a lot of patients, as you talked about with the previous caller, have a kind of preconceived notion of what their injury is. But you got to figure out what pathology is versus what someone's reality is, right? Do you have an injury that is actually causing your symptoms, or are you just having something that you're finding on imaging? And that's where it's really, really important that you're putting the physical exam findings together with the imaging. And again, we have the benefit of using very high-definition musculoskeletal ultrasound, which is an amazing tool where I can actually look at the tissue in real time. I can put stress on tissues to see if there's a tear there. I can move the patient around and maneuver them to figure out exactly what's going on. But a lot of people don't realize, you can find a pathology a lot of other places, but it's not actually causing any symptoms whatsoever. So we don't want to go chasing a problem that's not actually causing somebody's symptoms.
Well spoken, man. Very well spoken. Nita, do you have any questions of Thomas?
I do. Hi, Dr. Thomas.
Hey, good morning.
A few seconds ago, you talked about when you started learning what high-end athletes, the kinds of treatments and diets and things that they were doing. Can you suggest to us a couple of hints maybe about what you observed that would help, like just a regular sort of non-athletic person?
First of all, I'm going to give out our phone number again, get some more callers before the end of the show, even though this is amazing, Dr. Grove. It's Dr. Thomas Grove. The phone number to the studio is 866-870-5752, 866-870-5752. If you decide you want to call the office now or after the show, the phone number, and there's people there that can answer more questions, it's 800-300-9300. That's 800-300-9300. And if you want to watch videos of Dr. Grove and I on our website, it's www.jointrehab.com. There's videos of many, many different types of treatments. You can see if this is the type of treatment that you think you would want to get. So go for it, Dr. Grove.
Yeah, so in terms of, optimizing someone's treatment, optimizing somebody's health, I think in general just having some body awareness. If you got something that's bothering you, it's painful, that's affecting your life, get it checked out. I can tell you it's a little bit easier to catch something that's earlier and treat it with fewer treatments than if you have chronic pain for 50, 60 years. Typically, if you've got a knee problem, that could end up going to the hip or the ankle or the back or the neck, after 10, 20, 30 years. So that's a general piece of advice I give to people. Keeping yourself physically active is incredibly important. And if pain is one of those things that limits you from doing that, get it checked out and see if maybe regenerative medicine is something that can be a tool for you to be successful. Also,
I'd like to just put in that we do get people who have pain for 50 or 60 years, and regenerative medicine using platelets or stem cells can still help. It doesn't. That doesn't cut out. People come in all the time and they go, well, I've had this for so many years, this couldn't possibly help, and then they get helped. So the age of the injury is not really that relevant, and we actually have sometimes what we call acute injuries, which are new injuries that can also help. For instance, if someone has an ACL rupture in the knee, the first thing we do is we put the ultrasound on the knee, we see where the fluid is, we take every drop, we numb it up, take every drop out, and if it comes out red, we know it's blood, which means it actually might be an ACL rupture. But a lot of times the surgeons think it's an ACL rupture because an MRI shows that, and the MRI is actually wrong because MRIs are overly sensitive. They may show things that aren't even there. So the first thing we do with an ACL is we take the blood out and then let it start healing so you don't end up with a big blood clot there. And I don't know why surgeons are not doing this. It makes no sense to me because if you end up with a big hematoma inside a knee, you're going to have a problem healing up. So most of the time with the ACL ruptures, even if it's real, we can still heal them. And what I like to do is get right in there, put some stem cells in there, get the blood out, put some stem cells in there, and get the healing started. And I have some very high-level elite athletes that have had ACL ruptures ready for surgery that have never had to get that surgery done. And they're back on things like big waves, things that are very ballistic for the knee. So, you can tell I'm excited. I love this work, and it's
amazing. I mean, and just listen to what you just said, Doc. So you got people with an ACL tear that they think they have a tear that you don't have to have surgery for, and you get them back to their sport. I mean, that's such a huge difference in what the standard treatment is today, where you're, months and months and months of rehab and laying off of things. And here, a couple of weeks and you're back.
Sometimes a couple of weeks, sometimes a lot longer. Yeah. We can't prophesize. Yeah. And like I said before, the biggest failures are people being too active after a treatment. It doesn't give the tissue time to grow. Some people take anti-inflammatories like ibuprofen for headaches. That's going to blunt a little bit of the treatment. It's not going to kill it, but it's going to block some of the inflammation we need to sequester fibroblasts to the area, which are cells that grow tissue. And then some people come back after. We usually have people come back after 2 weeks to check them out, and they go, "It didn't work." Well, sometimes it takes more than one treatment. Sometimes it takes a few. And then a lot of doctors, the reason it doesn't work for people, we had somebody come in, Dr. Grove, I don't remember who it was, just a couple of days ago, who had several treatments. I wonder if it was the woman from Fresno with her husband who had the knee issues. And she said several treatments, but the doctor didn't use an ultrasound. Wasn't that her? I think it was.
Yeah, it was a patient, I think, of somebody's hip. Yeah, which just brings up a really, really good point is, you have to deliver these cells, these healing cells, to the area that needs to be healed. So using the benefit of ultrasound is, you can see those cells going exactly where you want to actually heal that tissue. So if you're not getting that done, unfortunately, it's really tough to say, hey, am I even getting these cells to that area that wants to be healed?
I don't know how much of a rush you are, Dr. Grove, but we have Chris on the phone waiting, who you can stay on if you'd like to, because we have a lot more to talk to you about, or you can take off and get on your way, whatever you like to do. But I would like, and thank you so much.
Absolutely, I'll hang out.
You'll hang out. Okay, good.
Oops,
they got rid of him.
I didn't know that. I thought I could bring him
Dr.
on
Grove,
together. Please call back in, Dr. Grove.
Yeah, we're going to go to Chris first here. And Chris, Dr. Marc Darrow, and you're from Sylmar. What's going on with you?
Hello, Doc. I was one of your patients. A little bit of a history. I came to you, it must have been about a year and a half ago, and showed you my MRI, and you did your evaluation on me. Life got in the way, and it was about a year after that, I finally got tired of the pain, and 3 weeks ago, I came in for the injections. Dr. Groves, he's a great guy, fantastic man.
Thank you.
And he went through the procedures. I got the stem cell injections in my shoulder. He's very knowledgeable about everything. Showed me exactly what was going on the ultrasound. And when we get done with the injections, naturally, it was an experience. I'm not going to say it wasn't.
But, shoulder injections can often be a lot of injections because it's such a mobile joint that we have to cover all the possible bases. And sometimes, to be honest with you, Chris, we don't know the exact pain generator. So we want to cover the areas that it could be. We'll cover the obvious things. If we see a tear, we're going to put some cells in there. But then we cover the areas that are not quite as obvious to make sure. Because the obvious areas don't necessarily mean that's where the pain is coming from.
No, exactly, yeah. Well,
now, if someone comes in for a knee procedure, injections of platelets or stem cells, that often can just be one injection, one simple injection. And if we have to aspirate fluid, which we can see with the ultrasound, we numb up the area first so you don't even feel it. So your shoulder can be more problematic for the patient because there's more injections. But, I've done this to myself. I've injected my shoulder, and it's not a big deal. And actually, anytime I go to a national meeting, when they ask for a volunteer, I raise my hand and I let them inject me all over the place. So I've laid there for over an hour getting injections, and it's not really a big deal. Nobody likes getting an injection for anything, but it's not a big deal. I mean, patients don't have problems with it.
No, I didn't have problems with it. It's just, like I say, you hit because he did it my shoulder, and then I had a small tear in the muscle going down from my shoulder into my arm.
Sure.
And just when you hit nerves, you can feel it. But,
well, we don't really hit nerves. When you talk about nerves, you're talking about a big body of a nerve. But there is
mine went well. I'm doing great. I slept very good that night. I didn't have hardly any pain in my shoulder or arm.
God, that's great, man. Thank you.
The next morning I woke up. I came back 2 weeks later, and we checked it out. I got good mobility in my arms. Naturally, I'm still healing. I know that. Doing the little exercises that the gentleman gave me the paper to do.
Yeah.
But I just wanted to thank you and him for helping me out. I mean, I'm doing good, and I'm
well.
still
Dr.
healing,
Grove is listening to you right now. He's on the radio too. So.
Yeah, it's awesome to hear. I love it.
Yeah, he knows his work. I guarantee you that.
Yeah.
He knows what he's doing.
Again, I'm going to say this. I think Dr. Grove is probably the number one guy in regenerative medicine. I'm so grateful to have to work with him now.
Yes. Well, you got a good one there. So I just wanted to thank you all. You did great.
Thank you, Chris. God bless you.
And everything. So.
All right. Thank you so much.
If something comes up again, I'm sure I'll be back in your office.
All right. Thank you. I'm going to give out the phone number to the studio again in case we get some stragglers in here. It's 866-870-5752. That's 866-870-5752. And if you want to talk to the staff, you can get a free consult with the staff, not a free consult with Dr. Grove and I. That's the staff. That's 800-300-9300. You can call them right now. They know what the stuff is all about. They can give you tons of information. And if you want to watch videos of these procedures, go to www.jointrehab.com. That's our website, www.jointrehab.com. And there's videos of Dr. Grove and I discussing many of these matters. And get to know Dr. Grove. He is one of the most amazing people I've ever met in my life, not just for his amazing qualities as a doctor. He's an amazing doctor and a great technician, great injector, uses ultrasound for most of his injections, but just a great soul, a great person, someone that's fun to hang out with, and it's nice to be around a guy who's so positive. I'm just so grateful for you, Dr. Grove. So
Appreciate you, Doc.
Yeah, I know. We have a good thing going on. Let me think of other questions, or if there's anything you can think of, Dr. Grove, about this area of medicine that you think is important for people to learn. We've got about 3-4 more minutes left.
Yeah, I think we can talk a little bit more about what you're just mentioning there with number of injections. So it's really important to understand that someone has an injury. A lot of times it's more than one area that's injured, and the shoulder is a really good example of that. Is, hopefully it's just only one thing. Maybe you just have arthritis and it's one shot and you're okay. But a lot of patients, you also have ligaments and tendons and maybe muscles that are also damaged.
Dr. Grove, I'll see you at the office. We got to run.
Oh,
there
you
goes
do?
that.
Okay,
there goes that. There goes that banjo. So God bless you, Dr. Grove, Nita, Alex, Suzette, the rest of the staff. If you want to get to my office, call 800-300-9300. There's people there that can answer your questions right now. If you want to watch videos, go to the website, www.jointrehab.com. We love you.
See you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab and sports medical center experts for free, and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.